Hi, my name's Cheryl Cohen, and I'm a person living with rheumatoid arthritis and the president of Arthritis Consumer Experts, reporting here from the Canadian Rheumatology Association annual scientific meeting in Whistler, British Columbia. We are very, very thrilled and honored to be joined by Cathy Hofstetter. Cathy is a patient living and a person living with rheumatoid arthritis. She was also the keynote speaker in the Mind the Gap Symposium this morning here at the meeting that really focused on discussion around improving patient outcomes for the person living with arthritis. So I'm absolutely honored that you took a few minutes to talk to us, Cass.
It's very nice to see you again.
After all these years.
After all these years.
I'm just wondering, you know, you just came out of the symposium, and what are your sort of immediate takeaway thoughts for you?
I think it went really well.
Yeah.
I think it was very successful. I think it was well received, and I think it gave everybody a lot of food for thought going forward.
Yeah. Do you think that the view of trying to treat to target, which we heard in the meeting, is actually much larger than just prescribing medicine? Do you think our view as patients is well matched with the view of the rheumatologist?
I don't think it is right now, and I think it could be better, but I think patients also have to speak up more about what their needs are.
Right.
Because rheumatologists are not mind readers, and they're not going to assume anything, and they don't know their patients that well when they only see them every few months. So I think it's our job too to make sure that they understand what our needs are and what our issues are,
right,
so that we can align them better than what they are right now.
Right, I think that's a great point. One of the things that I found in the meeting was we talk about treat to target, and from a rheumatology perspective, it's a bit, I'm not suggesting it's easy, but there are some hard measures and some tools they can use to assess whether they've achieved their goals as a clinician. But we haven't really been given the tools that says, well, you know, if I'm employed in such a position, these are the things I'm going to need from you, my healthcare system, to help me get to that target. We don't have that right now.
No, we don't, and our targets have not really been addressed. And they haven't been part of the equation. They haven't been part of the discussion along the way. It's always been mostly about the medication that you prescribe. It's about the treatments you prescribe, like PT and OT. And it isn't so much about what a good outcome looks like to a patient or what a successful outcome is to a patient.
Right.
And that's really important to address.
Yeah. Well, thank you so much for bringing our voice to such an important proceeding. It's really important, and it doesn't happen often enough, but success comes with small steps, and we appreciate you taking the step for us. It's very, very great. You've had a chance to go to some of the workshops, and we're wondering just quickly, what have you been hearing? What excited you about those workshops? What did you learn?
My two that I went to were both by Angelo Papachristos, who is an allied health professional. He's an ACPAC practitioner with St. Mike's Hospital in Toronto. I know Angelo. I've worked with him. He's been my physiotherapist, as a matter of fact. That's how I met him. One of the workshops I went to was lifestyle and working with RA, and the other one this morning was about exercises for low back pain, knee, shoulder, and plantar fasciitis.
Wow. And
they're both really, really, really well done. It gave me a lot to think about.
Yeah.
My big concern is being able to work, because I have to be able to support myself. So I have to be able to continue to work and work through issues, or work through times when I've had to have surgery, work through different issues and, you know, flares and changes in treatment and all that kind of stuff. So anything I can learn that will help me through that.
Is because you've been someone with long-standing disease.
21
years. Yeah, so it's less really for those of us who are oldies with it, not to date us, no. But for those of us who have been living with disease for such a long time, it's not really about, you know, what's this medication all about, what side effects. Like, those are things you learn very, very early on in the disease experience, right. And now it's about how do I get from point A to point B efficiently without pain and still have to try to have some fun along the way.
Exactly. And
yeah.
How do I stay engaged in my community? How do I still do my volunteer work with the community? How do I stay active in my children's school? How do I go to their soccer games? How do I do all of that? How do I have an active social life when I'm exhausted at 9 o'clock at night? Like, all of those are skills that you have to learn along the way.
Well, it's great that at this meeting, the Canadian Rheumatology Association now has as its partner in the meeting the Arthritis Health Professions Association, right, which is the home for all of these great people, right, and for Angelo, one amongst hundreds of them across the country. So it's great that we get to hear that kind of science is happening and then be able to incorporate the findings in our own lives.
It's a big part of living well with arthritis.
Yeah, absolutely. Our final question for you today, I know is going to be a tough one, but if you were to close your eyes and think about the future, if you could make the future happen in the next moment, what would it look like to you? What would the big platinum medal be? On the heels of the Olympics, we've created the platinum arthritis medal. What would the medal look like? What would that podium look like for you?
I would think that a diagnosis of rheumatoid arthritis would not be as terrifying as it was when I was diagnosed. That you knew right off the bat that you wouldn't have to fight to access the medication that you need, that you would have the support systems around you that you need so that you can live well with this all the way down. Because too often there's so many things that happen early on in disease that affect you and impact you, that change the way you live, the way you think. And I would love to see a day when it was more routine to have all those supports in place, that you didn't have to fight for everything that you got.
So just a pathway that's easy
just
to
a
walk
pathway
on.
That has no rocks, no moats, no snake pits, just straight, clear, no bumps, nothing to catch you or trip you. That would be wonderful for people being diagnosed in the coming years, and we know there's going to be a lot of them.
Yeah. Well, I'm already fantasizing in my head that I'm walking down that pathway, and you brought a tear to my eye. I just want to thank you so much, not only for being such a leader in our community over the years, such a great spokesperson.
I learned from the best, though, Sharon.
No.
You.
And just for your continued volunteer work in the community. It changes and saves lives every day.
Well, I just hope that somewhere along the line there isn't some other 36-year-old woman who's sitting on the side of her bed crying because she has to face another day and just doesn't have the willpower or the resolve to do it because she doesn't have the right supports in place.
Thank you very much, Cathy Hofstetter.